I'm Jack Roberts, and this is my presentation on psychological and physiological responses to injury. Okay. So, first we have the physiological responses. So the first one is pain. Pain is like an instant, it's an acute effect, so it will happen initially. It will probably be the first symptom you'll experience. It's a way of your body telling you to stop whatever you're doing. Naturally, your body will stop to prevent further injury. So your body will shut yourself down basically, and swelling will increase the blood flow. Therefore, there will be more pressure on the nerves, which is why pain will occur. Next, we have swelling. Swelling happens shortly after injury occurs. It's caused by the fluids going into the injured area. Fluids which are in order to prevent infection and further damage. It will drain the chemicals away, which also causes more pain, and tissue fluid will start to form around the area, which is where you see the inflammation and like a big lump around the injured area. And then we have the redness of skin and heat. This is where the skin colour around the injured area will start to look and feel hot. It will look red, and it will feel hot. This is because of the increased blood flow to the injured area and damage to the blood vessels. This will just increase the heat because the blood flow will rush into it, which is closer to the skin, so it will just feel hotter. And redness of skin, obviously, because it's red blood closer to the skin, so it looks red. We have scar tissue. This is, at first, the scar tissue will be random, so it will just be there to stop, recover initially, and then after a few months it will begin to stretch, and this is when the remodeling stage will start to occur. When the new scar tissue forms, it will form in parallel lines, giving it strength. So, given that you don't re-injure it, the scar tissue will form to provide maximum strength it can. And lastly, we have reduced range of movement. This means that your body will not allow you to move the injured area, as it will cause further damage. The body will not allow movement because of swelling around the joint as well. So because of these many things, it will just restrict movement around the injured part and will not let it get any worse. Next, we have how these link to different anatomical structures. So with bone, we've got all sorts of different effects that could happen. So depending on the injury, will depend on what happens. So like a broken arm or something, broke your arm. Depends if you snap the bone in half. What the body will do will depend on the injury. We've got ligament. Ligament is muscle to bone, so this will depend on obviously what happens to it. There are 3 grades of ligament springs. We have grade 1 and grade 2. These are less severe. The ligament remains intact, but there is some damage to it. And we have grade 3. This is when the ligaments completely tear and is commonly referred to as a rupture or tear. Then we have the muscle. So we've got different types of what happens to a muscle. You can tear a muscle, you can strain a muscle. These link into obviously the first responses, so depending on what's happened. For example, if you've got a muscle tear, it will increase, there'll be more pain than if you just pull a muscle as such, or rupture it. Strains and sprains. Strains are is where ligaments get torn. Sprains are damage to the muscles, and a fracture is to do with, again, links in with bones. The physiological stages. So we start off with inflammation. Inflammation is an initial response. It happens soon after the injury. Happens when the tissue has been damaged. Damaged cells release chemicals that cause a swelling to protect the injury. And obviously, because there's blood rushing towards it and inflaming the area, this will put pressure again on it, cause more pain. Blood supply is increased, obviously, to help repair. White blood cells will eat any dead cells, and platelets will then clot the blood, meaning bleeding will stop if this is necessary. Then we have the repair stage. So as I previously explained, if you have scar tissue, initially they'll just cover the skin and form at random, but when you get into the repair stage, then we go on to remodeling stage, which is to do with the scar tissue as well. This is where the scar tissue starts off random and then forms parallel to cause strength, as we've already explained. And then we have blood clotting. This is if it's obviously if it's bleeding, got an injury which causes bleeding. Blood clotting is an important process that prevents excessive bleeding. Platelets and proteins in your plasma work together to stop the bleeding by forming a clot over the injury, and which is why you get a scab if you've ever cut yourself. An injury example, so we have the ankle sprain. If you are treating someone with an ankle sprain, then it's simple. You use the guidelines RICE, which is rest. Simply rest your ankle by not walking on it. Ice it. This is to reduce the swelling. Compression is to help control the swelling as well as immobilize to support your injury. And elevate the foot. This is simply reclining it or propping it above the waist as the heart, above the heart, so there's not much blood flow going through. Swelling will usually go down in a couple of days. The more effective you do this, the quicker it will go. And then we have bleeding. This happens immediately after an injury to the skin that leads to bleeding. Your blood vessels constrict and reduce the blood flow to the injury site. This is where blood clots will form within the injured blood cells, blood vessels to prevent further blood loss. This is the initial stage. And then stage 2, you have inflammation. Stage 3 is proliferation, and this is the growth and rebuilding phase where blood cells arrive to help build the new tissue or replace the tissue, and cellular replace it. And then you have the remodeling phase. This is where inflammation is gradually resolved and collagen is deposited. New tissue takes place, and this is again leads back to the scar tissue where it forms randomly and then goes back into the remodeling stage. Psychological responses. So we have fear, stress, and anxiety, depression, anger, denial, frustration, and decreased confidence. Fear is simply if you've injured yourself, from then on you will be scared to redo it, depending on what happens. For example, if you snap your leg in skiing or something, every time you go skiing you'll be wary. Stress and anxiety, if there's a big game coming up or an important competition, you'll be stressed and anxious towards it. Or if you've injured yourself and you're returning back to sport, when you return back to sport you'll be anxious or stressed over not wanting to do it again. Depression, if you've gone on a bad run of losing a lot of games or so, can lead to depression, and then this will affect the athlete's performance further on because it links into motivation because they'll have a lack of motivation. Anger, if you've lost a game or you're losing a game, you'll be angry, and this can lead to a lack of performance as you're not concentrating on the game, you're purely angry, which can drop performance. And then denial is where you say you've injured yourself and you don't believe you've injured yourself, you can make it worse. Frustration is pretty similar to anger, and decreasing confidence Again, if you're losing, then your confidence drops, and if your confidence drops, so does your performance. Psychological response to treatment and rehabilitation. So we have anxiety, frustration, motivation and goal setting. Anxiety will be if you've injured yourself, you'll be scared to go through the rehab phase. So you would, for example, if you broke your patella or so and you need to do exercises to strengthen it up, but you're scared to do it in case you injure yourself, it can have long-term effects on your knee and it might not fully recover. Frustration, if you are going for rehab and it's not going fast enough, you'll get frustrated, so you might rush it. This in turn will lead to your, or whatever you've injured, not properly recovering and not completing